Okay, Assalamualaikum warahmatullahi wabarakatuh. I'm Nur Iman Nabatlisha binti Azhar from HS2446B. So today I will perform assessment and treatment on the patient. So for the first question, a football player has landed on his foot and hurt his ankle. So as a physiotherapist, I will perform toe taps, which stand for T, talk, O observe, T, touch, A, active movement, P, passive movement, and S, skills. So, toe taps is performed to identify the severity and extent of the injury in athlete, and also to determine if the patient can resume playing in the sport, or we have to refer to the medical attention. So the first one is talk. Okay, I will ask the patient. Okay, sakit dekat bahagian mana?
Situ.
Okay, so the player claimed that he hurt his right ankle. Okay. Okay, jatuh macam mana?
Jatuh masa main bola.
Dia jatuh macam mana?
Terseliuk.
Okay, after talk, I will observe the injured area and compare between right and left side, and see if there are any deformities or swelling or any redness on the injured side. Okay, next I will touch the injured area and around the injured area and see the patient's facial expression, if there's any pain upon the palpation on the injured side. Sakit?
Sakit.
Okay. Next is active movement. Ask the patient to move the ankle. For the active movement, I will ask the patient to actively move the ankle. Okay, angkat naik atas. Okay, turun. Okay, angkat dua-dua. Nak bezakan antara injured and uninjured side. Okay, turun. Okay, cuba masukkan kaki ke dalam. Yang this side, injured side. Okay, keluar. Okay. Next, for the passive movement, I will move the patient's ankle passively. Sakit?
Sakit.
Okay. And see if there's any limited range of motion or pain throughout the RM. Okay, and the last in toe taps is skills. Test the patient's skills. The patient can perform. First, walk casually. Okay, belakang. Okay, next, lari empat. Okay, lari depan. Okay, belakang. Okay, next, try jump empat. Okay, good. Okay, so if the patient can perform until skills, that means the patient can resume playing in the sport. But if the patient injury is severe, we may refer the patient to further medical attention. If the injury is just mild, maybe can bring the patient to the side of the field and apply ice for acute management. Okay, for the second question, rigid tape for ankle instability. So first, make sure the patient's skin is not too hairy and oily, and make sure the patient is clean from any skin condition, skin allergy or skin infection, or any other condition which is contraindication for the rigid tape. Okay, first, you need to apply anchor above the ankle joint, depan sikit. Okay. Starting from the middle, make sure there is no pressure while applying the tape. Okay. Next, from the medial part, pull the tape through the medial malleolus. to the heel and through the lateral malleolus. Okay. Okay, we need to apply at least 3 layers. For the second layer, apply slightly anterior to the first layer. Okay, but at the middle part, make sure it overlap with the first layer. Directly overlap. Okay. And for the last layer, slightly anterior from the second layer and overlap at the middle part. Okay, and rub to increase adhesion. So these are the 3 layers of rigid tape for the ankle instability. Okay, and lastly, after tape, applying the second ankle. Sekejap, lepas sikit. Second ankle. On the same spot as the first ankle. Without any pressure. Okay, for the third question, I will apply K-tape on the patient's elbow because the patient has a positive test of Mills which indicate lateral epicondylitis or tennis elbow. So first we need to make sure that the patient's skin is not hairy and oily, and also the patient is clear from any skin allergy or skin infection. Okay, make sure the patient's skin is clean. So first, okay. For the first, we need 2 strips of K-tape. The first one is a long one, and the second is half of the first strip. And the edge of the strip need to be round. So the patient's elbow must be in 90-degree flexion. Okay. For the first strip, the ankle must be above the elbow. Make sure there is no pressure on the ankle. Okay. And then stretch. Stretch with moderate stretch anteriorly. To the anterior forearm. And lastly, apply the second ankle at the end of the strip with no pressure. And add adhesion. And rub a few times to increase the adhesion. This is for the first strip. For the second strip, the first ankle is below the elbow. Make sure there is no tension. The first ankle is below the elbow. Make sure there is no tension on the ankle. Okay, and then apply moderate stretch to the anterior of the forearm. Okay. And for the second ankle, make sure there is no stretch. And rub at the edge of the strip frequently to increase adhesion. So it will look like this.